Welcome to Bad Nurse Files. This is our second episode of Bird Flu, where we're going to be covering human cases and why the numbers are wrong. So let's dive right deep into it. So, our first case in 2022 was our poultry worker in Colorado. He or she did recover and they just experienced fatigue, and it was concluded they contracted it from a sick bird. So then we've had sporadic reports of human cases in 2023 and in other countries. 2024 is where we start seeing a spike in human cases here in the United States that we're going to go over. So, reported in 2024, we've had a total of 70 cases. 41 are cattle related, 26 are poultry related, 2 are other animals, and 3 are unknown, which that is still I still don't understand that. So we have 3 cases of bird flu that we don't know where they contracted it from, but there's still no human to human cases or reports. But you're going to question that in a few minutes, just like I did when we go over the hospitalized patient. So we see the first hospitalized patient in August 2024, and their household also tested positive, but no human to human. Rather, they were exposed to the same thing, but there's no reported cattle or poultry exposure. So we still don't know. So they tested positive for influenza A and they subtyped, and it was bird flu, which is why I always have said this and I made videos about this constantly, that we don't know the numbers because this was the worst respiratory season we've had. 75% of those cases were influenza A. Most were not subtyped. You were only subtyped if you were critically ill or if you said you were around animals. So if you were outpatient testing, you were not subtyped. So we don't know who had bird flu and who didn't. And we had the highest pediatric deaths since post COVID. So we'll see. So this is where it gets sticky for me. It says that 6 healthcare workers reported symptoms after dealing with this patient. One tested negative. The other 5 were not tested during their symptoms. They were tested 3 weeks after. Doesn't make sense to me. So either they were not tested or they were tested too far away from the exposure. So, of course, they tested negative or there was no human to human or any kind of any kind of evidence saying that they were exposed, but they did experience symptoms after dealing with this patient, but no human to human yet. We had our first reported death in Louisiana, a 65-year-old woman who had underlying conditions. Her exposure was to backyard poultry, and her contact list reported no positive cases. So, I don't know if you're aware, but the CDC has stopped monitoring bird flu due to no cases since February 2025, which I think is ridiculous because in February 2025, there were reports of asymptomatic veterinarians. So they tested 150 veterinarians. 3 came out with antibodies against H5N1, but they didn't report any symptoms, meaning they were asymptomatic. Meaning, just like COVID, we had silent transmissions. So we don't really know if we have human cases. And another reason why we don't know if we have human cases is because the highest risk population are farm workers and veterinarians. Did you know 66% of farm workers are immigrants? I don't know if you're aware of the state of this country and how immigration is going. We're booting people out left and right with or without status. Um, I'm a first generation. I was a birthright citizen. So when I heard that news that they were going to probably revoke or had ideas of revoking birthright citizenship, I freaked out. Being a citizen myself, being born here. I've been here 36 years, born here. So I can imagine being an immigrant, sick. I'm not going to go to the hospital. So numbers are wrong. So we don't know the deaths, we don't know the infections, the transmissions, we don't know anything. So, since February 2025, we have been silent with no detected human cases. So, that to me is fishy. That to me is screaming that there's human to human already. I already suspected human to human in December, especially after reading all those articles about the Missouri patient and the healthcare workers. So, I don't know why the CDC isn't pushing for this. This was during the Biden administration. So when people say it's a Biden or a Trump thing, it isn't. An this is a 1% versus us, basically. This isn't left or right. This is us versus them. Both parties, both administrations have been telling us the wrong numbers. I've been saying it. Bird flu is a 2020 vibe with a 2020 response. I hope we don't have a 2020 outcome. That's why I am pushing these videos out. So, yeah, follow to stay in the know.